Hi, my name is Dora and this is Chin, and today I'm going to be teaching you about vital signs. So vital signs are important for you to know what is normal before what is abnormal. So knowing your horse's common behaviors, their actual vital signs, their daily routines is very important. So the first vital sign that I'll be talking about is mucous membranes. So in vital signs in general, I normally like to start at their head and work my way down because then I know that I didn't forget anything. So mucous membranes are openings and linings of the body. So those include the gums, the conjunctiva of the eye, as well as the vulva of the mare. So what you normally want to look for is pink and moist. If they're dry, this could indicate a lack of hydration. And if they're yellowish, that could indicate jaundice. If it's brick red or bluish and purple, that can indicate lack of oxygen. And pale can indicate anemia or shock. So to do this, you want to pull their top gums up and then hold it up for a little bit just to make sure that you actually get you can actually see the color. Lighting can sometimes affect the color of the gums, so it's always important that you can see them very well. Some horses tend to be a little head shy with this, like her. Whoa. So you're just going to push their top lip up so you can see that her gums are pink and very moist. So that is a good sign. The next vital sign that I'll be talking about is capillary refill. So capillary refill is an indicator of your horse's circulation and if it's functioning effectively. So what you want to do is you want to push their top lip up and press down on it for a little bit and then release, and you want that blood flow to come back in 1 to 2 seconds. When you press down, it's going to turn a pale color, so you want that pink color to come back in 1 to 2 seconds. So the next vital sign that I'll be talking about is pulse. So pulse should always be in between 32 and 44 beats per minute. And the way you'll do that is I normally just time it for 15 seconds, and how many I count, I times by 4, and then that will be your pulse. So the pulse can be taken in any external arteries like the maxillary artery that runs under the jawbone, as well as the radial artery that runs right behind the knee. So today I'm going to demonstrate the maxillary artery. So you normally want to feel for something that kind of feels like a wiggly worm. That's how I like to describe it. And you use these 2 fingers. Always make sure to not press too hard because then you will end up feeling your own pulse. So hers is right here. And then you'll count for 15 seconds. So I counted 9. So that means that her heart rate is 36 beats per minute. And the pulse is a reflection of the horse's heart rate. It's just a different way of doing it. If your the heart rate can be accelerated after exercise, or it's a good way of telling if your horse is sick. That's very important. And it's important to consider factors that could affect heart rate. So for example, like I said before, exercise, or if it's really hot or humid, that can normally elevate it. So it's always important to consider external factors as well. So the next vital sign that I'll be talking about is skin pinch, also known as skin pliability. So this is just an indicator of your horse's hydration. Before doing this, it's always important to consider your horse's age, as older horses tend to have looser skin, so their skin will stay up longer. So when doing that, you need to make sure that you also check their mucous membranes, for example, to make sure that they actually are hydrated. So what you want to do is you want to pinch the skin in between the spine, the nuchal ligament, as well as the scapula, so that would be right here. And what you're going to do is you're going to gently pinch the skin, and it should take 1 to 2 seconds to go and back down and flatten. And if it doesn't, it could indicate that your horse is not hydrated. So if it does not go back down in 1 to 2 seconds, it's always important to check another vital sign just to make sure. So right here, I'm just gonna grab the skin, pinch it, and then you can see that it flattened in less than 1 to 2 seconds. So she's pretty hydrated. So the next vital sign that I'll be talking about is the heart rate. Similarly to the pulse, it'll be 32 to 44 beats per minute. This is just a different way to take it, and you'll actually be listening to the heart. So you'll use a stethoscope, and using the same method of calculation, you will listen for 15 seconds, and then how many beats you listen to, you will multiply by 4. And when you take this, you want to make sure that it's by the shoulder in the heart girth, and you kind of want to press inside. So I'll demonstrate. And then sometimes it takes a while to find the heart. So here I found it, so I'm going to start counting. So it was 9 again, like her pulse. So it's 36 beats per minute, which is in the range. So the next thing that I want to touch base on is the digital pulse. So the digital pulse can normally be felt on the inside of the ankle, below the fetlock, normally, which is right here. And you normally won't feel a digital pulse if there is nothing wrong with the foot. But if you do feel a bounding digital pulse, this could indicate that there is something going on, either with the hoof itself or the surrounding area. So it's always very important to check